Key differences between endometrial polyps and uterine fibroids. 1. Definition. Endometrial polyps. Small benign growths in the lining of the uterus, endometrium. Uterine fibroids. Non-cancerous tumors composed of muscle and fibrous tissue in the uterus. 2. Composition. Endometrial polyps, mostly made up of endometrial tissue. Uterine fibroids, composed of smooth muscle cells and fibrous tissue. 3. Size. Endometrial polyps, typically smaller, often less than 1 to 2 centimeters in diameter. Uterine fibroids can vary greatly in size from small nodules to large masses that distort the uterus. 4. Location. Endometrial polyps, typically found within the uterine cavity or protruding into the cavity. Uterine fibroids can be located within the uterine wall, intramural, protrude into the uterine cavity, submucosal, or extend outward from the uterus, subserosal. 5. Symptoms. Endometrial polyps, irregular menstrual bleeding, spotting between periods, infertility sometimes. Uterine fibroids, heavy menstrual bleeding, pelvic pain or pressure, frequent urination, constipation, back pain, infertility sometimes. 6. Appearance on imaging. Endometrial polyps, often seen as small, discrete masses on ultrasound or hysteroscopy. Uterine fibroids can appear as well-defined or irregular masses on imaging, depending on their size and location. 7. Risk factors. Endometrial polyps, typically related to hormonal factors such as estrogen levels. Uterine fibroids, also influenced by hormonal factors, estrogen and progesterone, family history, and ethnicity, more common in African American women. 8. Association with cancer. Endometrial polyps, rarely associated with malignancy, cancer. Uterine fibroids, benign, non-cancerous tumors. 9. Impact on fertility. Endometrial polyps may affect fertility, especially if they obstruct the fallopian tubes or interfere with embryo implantation. Uterine fibroids can impact fertility depending on their size and location, potentially affecting implantation or causing complications during pregnancy. 10. Treatment options. Endometrial polyps can be removed surgically, hysteroscopy, or sometimes managed with hormonal medications. Uterine fibroids. Treatment options include medication, hormonal therapy, minimally invasive procedures such as uterine artery embolization, or surgical removal, myomectomy or hysterectomy. 11. Recurrence. Endometrial polyps may recur after surgical removal. Uterine fibroids can recur after treatment, especially if not all fibroids are removed during surgery. 12. Associated symptoms. Endometrial polyps, often associated with abnormal uterine bleeding or bleeding after menopause. Uterine fibroids. Symptoms vary widely and can include pressure or pain depending on the size and location of the fibroid. 13. Hormonal dependence. Endometrial polyps may grow in response to estrogen levels. Uterine fibroids typically grow in response to both estrogen and progesterone. 14. Diagnostic challenges. Endometrial polyps, sometimes difficult to differentiate from other uterine abnormalities without imaging or biopsy. Uterine fibroids can be challenging to distinguish from adenomyosis or other pelvic masses based on symptoms alone. 15. Impact on menstrual cycle. Endometrial polyps, often associated with irregular menstrual bleeding patterns. Uterine fibroids frequently cause heavy menstrual bleeding, menorrhagia, or prolonged periods.